From Bloomberg Quick Take, I'm Madison Mills. The world officially recorded 1 million deaths from COVID-19, and some experts say fatalities could be closer to double that number. This comes as we're heading into the winter months and could see an additional uptake in cases. Joining us to discuss this and more is Dr. Tom Frieden, the former director of the CDC and the president and CEO of Resolve to Save Lives. Dr. Frieden, thank you so much for making time for us today.
Great to be with you.
Just to start us off, I'm wondering how you're holding up and how you're doing. This is a really tough time for everyone.
Well, I think one of the things that we recognize is that this is the teachable moment, that we are all connected. And the more we learn that lesson, the more we're going to do better. Looking all around the world, we see some countries doing really well and others, including sadly the US, not doing so well. Over the past few days, we've not just hit the official 1 million mark for deaths globally, but actually it could be twice that relatively easily globally, given underreporting in many countries of Asia and Latin America. And here in New York City, where our organization has its home, we're seeing a resurgence in some communities and the risk of wider spread. COVID is going to be here for the longer term, and we're going to have to adapt and chip away at the risk with a series of measures. So I think for those of us in public health, it's both a moment of crisis, but it's a moment of great frustration because we see countries all over the world not listening to public health, not following public health guidance, and that backfiring, and then the same mistake happening again. So we're hopeful that we'll see better responses. We're seeing some places in the US doing a good job and some places globally doing a good job.
And Dr. Frieden, you mentioned New York's positivity rate. Can you talk to me about what can be done to combat that spike?
What we're seeing in New York City is a rapid increase in some religious communities. And there are communities that are not well connected to the government and have quite a bit of crowding. And so I think there is a near inevitability that there will be more spread in these communities. What's not clear is how widely it will spread around the United States.
And so what do you think is something that New York is doing that other states could learn sort of not to do? I'm thinking specifically about indoor dining, just opened up in the city. We've seen some outdoor dining practices that I've heard you mention are not necessarily the safest. Can you talk about that a bit?
I think what's really important is that we take measures that are specific to the communities. And what we're seeing here is usually with infectious diseases, you don't have one epidemic, you have many epidemics. So whether it's meatpacking factories or agricultural workers or a religious community or different groups that have both crowding and less connection with the government and rest of society, that's a vulnerable location. And you need to work in advance to make sure that you have as much connection with folks there as you can so that you can draw on the strengths of that community to try to stop transmission, prevent it from occurring, stop it when it does occur, and really engage the community and address the needs of people living within the community. That may sound soft, but really that's the only way to succeed.
And how concerned are you about cases getting a lot bigger when we head into the winter months and people are forced inside?
Every season is COVID season. There were some people saying it would be less in the summer. I was dubious about that. I said that back in March and April. However, in winter months, we do tend to see colder months more spread as more people are indoors, less sunlight, less ventilation. We're not exactly sure of all of the reasons, but we do tend to see an increase in colder months. So it's certainly a risk. We're seeing outbreaks in university settings. We're seeing outbreaks in essential workplaces. So this pandemic is far from over, and there's no fairy tale ending to the pandemic. Even a vaccine is not going to make it go away overnight. We're going to have to chip away at that risk with what we call the 3 Ws: wear a mask, watch your distance, wash your hands, with strategic closures. Doesn't mean everything has to be closed, but bars bad idea. Lots of people, small space, poor ventilation, no masks, loud voices. That's basically a formula for the spread of COVID if COVID is there. Same with choirs and choruses. This is a very efficient way of spreading COVID indoors. So I think we need to get smarter about strategic closures that limit the damage to the economy, but at the same time limit the risk that someone will die from a social event.
You mentioned bars as a no-go for handling this pandemic, but I'm curious in general what people can do who are trying to be cautious and do the right thing, but are also kind of experiencing pandemic fatigue and may be having some negative mental health effects from staying inside. How can people find that balance of staying safe and sane during this time?
Right. Well, we're all sick and tired of this virus, but unfortunately, the virus is not tired of making us sick. And so we have to be careful, but we can adapt. First off, go outside. Outside is great. Sunlight, healthy, more vitamin D, fights infections, good ventilation, improves your mood. So spend time outside. It's massively safer than indoors. And it is good for your health and your mental health. And the risk is drastically lower than indoor spaces. So that, I guess, is first and foremost. Second, it's important to have routines that you follow, things that you enjoy doing. Try to figure out how to get those back, whether that's a book club online or figuring out how to do physical activity safely, or going about important patterns or rituals that you have that are important to you, and finding people you can talk with and share with. Online social events, it sounds strange, but it's better than nothing. And outdoor events, also important. Also within bubbles, being able to find a small group of people, if you can, if this fits your environment, who are not having contact with others, but can have contact with each other. One of the things we do in my family is my mother's 91. She lives alone. And what we'll do is one of us kids will quarantine essentially for 14 days. Then we'll go spend some time with her, or she'll quarantine. Then she'll go spend time with my brother. So there are ways to get through it. It's frustrating, but keep in mind that this too will pass. We can't say when. It's not going to be quick or simple. Even with a vaccine, it wouldn't be quick or simple, but it will pass. And the key is to stick with it and to emphasize those things that are good, being able to not have to deal with a commute, good thing for a lot of people, having other opportunities to interact and new ways to experience, not great, but at least there's a lot that we can do to have fulfilling activity.
And as we head into the winter months, another problem that's popping up is flu season, of course, and people are just getting colds and similar viruses because of being outside in the cold. I'm wondering if you can talk through some of the defining factors of COVID that can help people differentiate between a simple cold and COVID-19 symptoms.
Well, you really can't. The cold and COVID are very similar. The flu and COVID are really very similar. But first off, get a flu shot. It's the single most important thing you can do to protect yourself against flu. Second, one of the things that we say about flu is that the only thing predictable about flu is that it's unpredictable. But having said that, I would predict that we're probably not going to have a bad flu season in this calendar year. People are staying in too much. There's not that much travel. So it would be quite surprising if we saw a lot of flu. They're not seeing flu in the southern hemisphere when they usually do. So it's likely that we're not going to see flu at least through this year, but by all means get a flu shot. And this is just one more reason to be careful about COVID. The things we do for COVID, washing our hands, wearing a mask, watching our distance, are going to reduce other infections as well. So even if COVID isn't around, they do some good.
Fair enough. And we are heading into an election on November 3rd. I'm wondering what your take is on how the president has handled the pandemic so far.
Well, I think there's not the slightest doubt that the U.S. has been a laggard, that our response has failed. And because of that, we have one of the higher death rates in the world. Because of that, we have many more jobs and lives lost than could have been lost otherwise. There really is a lot more we can do to be safer, to have an organized response, to have structured communication about it, to tell people what they can do, to help people address problems, to scale up a comprehensive approach, to have clear indicators. The list of things that are not being done well by the US government really goes on and on and on. And if you look at places as varied as Iceland, Germany, Austria, Denmark, Taiwan, Hong Kong, Singapore, Rwanda, Senegal, you're talking about places that have 5, 10, 50, 100 times lower death rates than the United States. We really could have done so much better. It didn't have to be this bad.
And we, of course, are heading into the debate tonight. Is there anything that you are hoping to hear from either candidate that would give you a little bit of peace about how the country could handle COVID-19?
You know, I wish we would all recognize that we are all connected, that infection in any individual, in any group, in any part of the country is a risk everywhere. And we're all in it together. And the more we recognize that, the better off we'll be. The more anyone divides us, the more the virus can continue to conquer us. The more we recognize that we're in it together, the more we can push the virus back and get more of our lives and our livelihoods back.
And we do have a really young audience here at Quick Take. Do you have a specific message for young people about their involvement in this uptick in numbers?
You know, I'm encouraged. Despite some media reports, the vast majority of people, young and old, are really concerned about making others sick and understand that even if you don't have any symptoms at all or feel only mildly ill from it, you could end up infecting someone else and they could die from it. None of us want that on our conscience. None of us want that to happen. And just keep in mind, this will pass. It may feel like forever, but it's not. It's going to pass. It'll be better by late 2021, a year from now, and within the next few years, we'll be to a new normal. Things will be different. Maybe we'll be used to not going out when we're sick. Why should you expose other people when you're sick? Stay home, take care of yourself, and hopefully we'll be in a world that recognizes our common humanity and is better to one another because of it.
You mentioned 2021. What is your current thinking around a timeline for a vaccine?
We don't know. Anyone who says they know what's going to happen doesn't know enough. We don't have any proof that a vaccine works, is effective, is manufactured, can be delivered. We're guardedly optimistic there will be vaccines, but a vaccine is not going to bring a fairy tale ending to this pandemic. It's going to be one more tool in our toolbox. And we have to keep all of those tools sharp. That includes masking up, testing, tracing, quarantining, and vaccination. It needs to be rolled out in a way that builds trust so that people will actually take it. If we have the greatest vaccine in the world, but people don't trust it, it's not going to work. And that's really important factor to keep in mind as we provide information about the vaccine.
And we are heading into the holidays as well. Are you concerned that people who are traveling to be with loved ones over the holidays might end up leading to an uptick in cases as well?
I think travel isn't so much the concern, but what we are seeing is get-togethers with lots of people indoors. What you want to do is try to limit the number of people coming from different places and congregating indoors, because that's essentially the formula for spread. Think of it as an equation. Number of people not wearing masks, rate of COVID in the community, level of ventilation, and duration of time. You put those factors together, you're going to get spread of COVID.
Dr. Frieden, a final question for you. You've mentioned it a little bit, but what is giving you hope right now? What makes you hopeful that we won't see another million deaths in 2020?
I hope this will really illustrate that we're all connected, that within the US, we need a much stronger public health system. We need to fund it, we need to support it, we need to be guided by science. And globally, that all of our fates are really bound up with one another. That the more we can find diseases when and where they first emerge, stop them soon, whenever that's possible, and prevent them wherever possible, not only will countries be safer, but we'll be safer. we can be stronger there and safer here. And that commonality, that common purpose and common fate and common humanity, I hope will lead us to a safer and a healthier world.
Dr. Frieden, thank you so much for making time for us today. And for those of you watching, please continue to follow our coverage on COVID-19 on all social platforms at Bloomberg Quick Take. And thanks again. Have a great day.
Thank you.